I'm Dr. Shilpa, your host for today, and I'm a dentist by profession, and I'm the co-founder of this group, Endo Crusaders, which I and Dr. Vibi created with an aim to create not just a support group for women with endometriosis, but also to create awareness about this silent disease. Endometriosis, a disease which affects approximately 176 million women worldwide. Imagine 176 million women and still unknown. It's a condition in which tissues similar to the lining of the uterus is found outside the uterus. It's not the endometrium, but it is something similar to it, where it induces a chronic inflammatory reaction that may result in scar tissue. It's primarily found in pelvic peritoneum, on the ovaries, in the recto-vaginal septum, on the bladder, and the bowel. Actually speaking, it is just the spleen which is not affected with endometriosis. Rest everything in the body can get affected. That's how crazy endometriosis can get. So our guest today is extremely special, as she herself is an endo warrior. Arti, by profession, is a content producer, but has been a passionate, she's been extremely passionate about creating awareness about endometriosis. She was diagnosed with endometriosis in 2004, and since then, or to say the truth, even before that, she had her share of long, painful story. Initially, as most of the patients with endometriosis, Arti was also given hormones, but that was not something that was helping her. In 2018, she started exploring acupuncture because she wanted to try a holistic approach. And the holistic approach and the change in diet has really, really helped her. She, being an endo warrior and an endometriosis advocate, has been trying to educate and help as many women with endometriosis as possible via endometriosis support groups in Kenya. I'm so thankful to Arti for her to join us today and share her experience and knowledge with us. Arti, welcome to Endo Crusaders.
Thank you so much. Thank you, Dr. Shilpa, for having me on your amazing platform. It's amazing what you and Dr. Vimi do. It's absolutely amazing.
Today we are missing Dr. Vimi. It's always been a session together, but unfortunately she's not keeping too well today, so she could not join us on the live stream. So, Arti, let's begin this session by this very small question about how did you get diagnosed and how long did it take for you to get diagnosed?
So obviously got diagnosed with endometriosis through laparoscopy. Mm-hmm. And it took me, I think, after 10 years, almost 10 years of misdiagnosis.
10 years.
Yeah. Which has been the standard period of misdiagnosis for most women. Most endo warriors go through that phase.
Absolutely. True.
So I basically was, I had in 2004, I had severe pain, and I was rushed into hospital and I couldn't even walk. And that's when when the ultrasound was done, I had a cyst in my ovaries, which is the size of a cricket ball. So I was rushed into surgery, and that's when through laparoscopy, I was told I have endometriosis.
All right. So I would just tell the audience that laparoscopy is the only gold standard for diagnosis of endometriosis. Yes, the other imaging also does work, but to have a correct diagnosis, a diagnostic laparoscopy is necessary. So what were the symptoms that you were facing? Period pains is one of the very common symptoms which is there. Besides period pains, what all did you have?
Besides, this is at the time of diagnosis or during the journey for endometriosis?
Before the endometriosis was diagnosed, what were you going through?
So, I was also battling chronic depression from a very young age. So I didn't realize, that I had never heard of endometriosis prior to when I was diagnosed. Even when I heard about it, I was like, sorry, endo what?
Correct.
and obviously had very painful periods. I used
Mhm.
to, because I was battling chronic depression, I was very nauseous, had a lot of anxiety, had, a lot of dizziness. I used to be highly, highly anemic. So I didn't know that I was battling something else that's bigger inside that was obviously correlated to having this trauma from childhood, fighting depression, which led to worsening the condition itself. So I can't really pinpoint the symptoms leading to periods and endometriosis because I was just in a whole baffle of feelings.
Correct. Correct. So, so actually speaking, you must have had endometriosis from a very, very long time. And those hormonal changes, because endometrial tissue per se produces its own estrogen. And that creates a complete imbalance in the amount of estrogen that you should have in your body. And plus the scar tissue and the inflammation that happens in the body per se creates more of a chain reaction which goes completely undiagnosed. Period pains,
Exactly.
which are supposed to be normal, you know. I mean, and no one understands what pain is normal and what pain is not normal. For
Yes.
any girl who is going through period pains, anything which interferes with your day-to-day life is not normal. I mean, I'm sure Arti would agree with that. She would have had days when she would not have been able to get up from the bed.
Of
True.
course, totally, completely. Even to date, given going through my whole journey to date, there are times when I can't walk or I can't hold things because of the endo progression, which we'll get into later. But you just have to force yourself and do it. Like, what other choice do you have? And people say, the problem with endometriosis, because it's an invisible illness, because you look fine from outside, everyone misunderstands and says, "Oh, what are you going through?"
You don't look sick.
No,
You don't
thank you.
look sick.
Neither do
That's
you.
that's the that's the thing that you keep hearing all the time. You don't
You
look
don't
sick.
look sick. And it just drives you mental.
Actually, because you keep hearing this over and over again, and a lot of people don't validate it. You don't get that validation for the kind of thing that you're going through. So mentally, it also starts acting. So, were your symptoms dismissed, and how did you feel at that point in time when your symptoms were dismissed, either by your family or your friends or your doctors, for that matter?
So you see, they were initially, I was told it's obvious, how ever the standard line is just period pain. Your parent, your mother's had it, your grandmother's had it, you just get over it. It's period pain. And I was
Correct.
just like, how do you get over? And as I said to you, because I was so confused in my head, my emotions were all over the place. So I just thought,
Absolutely.
if you're being dismissed for your pain, maybe it is in your head, because you
Correct.
didn't know. And then after, when I was diagnosed with endometriosis, I was told to get pregnant. And then I'm thinking, huh? Sorry, what's that? Like, I've just been told I've got endometriosis, and now you're telling me to get pregnant and it will magically go away. So, yeah, so it was a bit mind boggling, to be honest.
Absolutely. So, just when you said this, my doctor, when I got diagnosed with endometriosis, was after my life to have a baby. Not thinking about what kind of a pain I was going through, what kind of a
Mm.
emotional trauma I was going through, and was what was the main priority for me at that point in time. And the minute I told her that no, I don't think I would want a baby. I want my endometriosis to be taken care of because
Mm.
that's what is troubling me the most. I mean, for a baby, I can even think of adopting a baby, but then I can't stay in pain for a lifetime. And that's when her interest in me just went off. So, so that's how things happen, with endometriosis, with endo patients. And it's not a new story. A lot of
No.
us go through this, go through these similar stories all over again and again and again. So you
And I
told
just
that,
wish the doctors would say that, I just wish instead of saying get pregnant, they would walk you through what endometriosis is, how you're going to fight that journey, what to expect, what not to expect. Instead of throwing a bombshell, get pregnant. How about when infertility comes in? How about if you're not married? How about your age is not right? If you're not, mentally ready for even inviting anybody else into your zone of madness, so to
Correct.
say.
True. Completely agree with that. So, the quality of life of a woman is something which needs to be of utmost importance rather than she having a baby or she getting married or whatever suggestions that keep coming in from everywhere. Yeah. So, you told that you went through a laparoscopy and your endometriosis was diagnosed. So tell us about your tryst with endo. I'm sure we cannot take it completely in detail because it's going to be like a very long story. But tell us a little about how was it with endometriosis once the diagnosis happened.
So as we said, the second bombshell was to get pregnant and everything. So then comes the pressure of all of that. And you're thinking, you know what, you've just been told you're battling endometriosis. And I just wanted to learn more about that because I didn't know what it was. And then, there came, this is after the surgery, you're recovering from surgery. And then you're told that we'll put you on hormonal contraceptive pills after that's over. Because you've had the surgery, it's the best time to conceive. Whether or not you're in a relationship or not, whether or not you're married or not. And then I was just like, this is just ridiculous. So anyway, and at the time I wasn't mentally strong enough as well to be knowing that I should be doing my own research. I should be doing, trying to understand whatever I can about endometriosis. And saying that at that time, there was not even that much awareness about endometriosis as there is now. And then, I was put on Visan, which really was just a nightmare for me. Apart from endometriosis and its symptoms, then you had Visan and its side effects, which were
Absolutely.
obviously exacerbating the endometriosis symptoms. So that went really bad. Then I had two others. Then I was put on Yasmin because I wasn't responding to Visan that well. And then I had two more surgeries, after which I started traveling to Thailand. And I
Okay.
heard about very good friends of mine had told me about this hospital in Thailand, which is called the Bumrungrad. And there I went there and I was going there for 7 years for treatment. And this was all hormonal treatments. And the doctors there, the way they sat with you, ran through the ingredients of the illnesses to make sure even the contraceptive pill that they're putting you on doesn't have excess estrogen, so it doesn't react with your endometriosis.
Mm-hmm.
So all of that happened. And then I just thought, this is just enough is enough. Like, I just need to take charge of my life again, because it's just one thing going through what you've gone through childhood lifetime, your teenage lifetime. Now you have to battle, your work lifetime, your professional lifestyle. It was just a bit too much to handle. And then so that's how my endo journey took a turn.
Okay. All right. So
The
7 years
conventional journey.
Yeah. So 7 years you were traveling from Kenya to Thailand. Is it to
Yes.
get a
You know why? Because first of all, my surgeries were all ablation. They were not excision. I didn't even know about excision for until the last 3-4 years, to be honest. And this is true, endo warriors giving their testimonies. And that is why I exaggerate that it is so important to read and listen to people, endo warriors' testimonies, because you learn a lot.
Absolutely true.
Here we don't have, in Kenya, we don't really have per se an individual excision specialist who performs or focuses solely on excision for endometriosis.
Well, that's something which is very common actually, Arti, because even here in India, they are not a very. We can actually count the number of doctors who do endometriosis excisional surgeries. I myself being from the medical profession, I was not aware of the excisional surgeries which were there when I was going through my surgeries. I too went through an ablation surgery. I had to go through a hysterectomy. Without knowing, after I went through so much, that's when I was like, okay, this is not something which is helping me. So I have to start doing my own research, because the thing is, even the doctors are not aware of what exactly needs to be done. It is a specialized thing, and excisional surgery is the only treatment for endometriosis. Yes, I mean, change in lifestyle, the alternative therapies, and everything does help, but that is provided your excisional surgery is done, and it will help you prevent the flare-ups or a recurrence of the disease. But at least somebody has to do it first. You know, you can't do it yourself. So you need to have a doctor who does it. So, okay, so now you were going through a conventional therapy, the same hormones, ablation, blah, 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 all those things. How did you decide on looking at an alternative therapy to take care of your flare-ups due to endo?
So before I decided to go down the acupuncture route, 7 years ago also I stopped, I changed my diet. I made, which we'll discuss, we can discuss that later. But through the diet changes and lifestyle changes as well, then I said, you know what, a very close friend of mine also said to me to watch a documentary called Heal.
Okay.
And I watched that, and it was like literally like it opened up my mind to holistic form of therapy, for chronic illnesses. And that's when I decided, I started also, before that, I had also started writing journals. I started doing my own research. I started understanding what's triggering their flare-ups, what's triggering their relapses, what's not good for you. You had to write everything down. You needed to have a journal because you're the only person who can understand your body better than anybody else.
True.
And that is when I decided to go into finding a really good acupuncturist. And my acupuncturist doctor, he's amazing. He's a Chinese doctor. And I believe that when you're going down a holistic route, always go with who has practiced it, what's in their tradition to practice it. And they've been practicing it and they've had knowledge about it for thousands and thousands of years.
Absolutely.
And that's how my journey with acupuncture began.
And that really helped you. So, what exactly happens in acupuncture, and what is the basis for this treatment?
So, acupuncture is about balancing your qi and your yin.
Okay.
Right? It's all about energies, it's internal healing. And it's also about, when there's an off balance in your system or in your body, then you will feel the pain. So the treatment of acupuncture basically involves needles being inserted into certain pressure points of your body, which can be painful, don't get me wrong, or it can be okay as well. And basically, when the needles go into those pressure points, it stimulates the central nervous system. And this in turn, it releases chemicals into your muscle, spinal cord, and your brain.
All right.
And these biochemical changes stimulate the body's natural healing abilities and promote physical and emotional well-being. And wherever there are blockages, which are caused by certain illnesses, that's where healing starts, and that's where those chemical reactions start opening up. It is a very painful journey initially, especially when you're battling or rather treating a lot of illnesses, because endometriosis does not just come with endometriosis. We all know it comes with a whole bag full of other illnesses.
True.
True. And that's what acupuncture is about, from my personal experience.
Yeah, absolutely. See, it's something we invited you here because you have gone through it. It's a personal experience you have gone through. Every person is different, but we just wanted to give a perspective to our viewers about, besides conventional therapy, there is something else which you can look into, which might help. Anything that helps you, be it the regular therapy, the regular conventional allopathic therapy, or or the alternative therapies. because when you have endometriosis, you're already going through so much that whatever helps you, you know.
Yes. Yes, totally.
Exactly. So how often does one have to go through these sessions?
So it all depends on your body and the conditions that you have, and also the level of where the illnesses may be. I initially was going almost 3 to 4 times a week,
All right.
and it was very extensive, and
Mhm.
also and it sometimes depends also on how bad I was. Um, Now I go once in 2 weeks or once in a week, again, depending on the flare ups or what I'm going through. I have had about 36 sessions now.
All right. Okay.
And yeah, so also um, through the acupuncture, I also was given a lot of Chinese herbal medication to take.
All right. All right.
Yeah, which helped a lot. Initially, obviously, it was the initial phase, I won't lie to you, Dr. Shilpa, was a roller coaster ride. It was hell. Like initially, what I went through with endometriosis and the amount of medication I had to take in a short periods
Mm-hmm.
was literally a living nightmare. But this is the thing with holistic treatment. It
Okay.
works slowly but surely. It's not a cure, but it helps you manage it so much better. And my symptoms and my flare-ups have gone down tremendously. I mean, I'd have a flare-up that would last about 7 to 2 weeks. 7 days to two
7 days to
weeks.
2 weeks. Oh my God.
Yeah, and now they last. I mean, then it went down to 5 days, and now it would last about 2 days,
Oh, that's
which
cool.
is
That's like
huge.
that's like yeah, that's like quite a big change. From 14 days
Yes,
to 2 days is like amazing, amazing. I mean,
yes.
I think you must be like thanking your doctor who's doing this to you.
Definitely. I sent so many. I'm always lobbying about it. And yes, acupuncture it is expensive, especially if you don't
Yes.
have medical cover. But the good thing about the doctor here is they have the Chinese. So they have a Chinese medicine called Fubao, and I'm not promoting any of this, but
Correct.
on the packet it reads, obviously it's been there for thousands of years, and it reads it dissolves endometriosis. I'm assuming it dissolves endometriosis adhesions. And I've been taking that, and I've sent ladies there who suffer from fibroids, who needed um, emergency surgery, and after taking that, the fibroids just dissolved. But
Wow.
again, it depends on your body. It depends on where the extent of your condition, and it also depends on how religiously you do it, and also
Makes sense.
believing.
Makes sense. You have to have faith in whatever you're doing.
This is it.
Uh, just to uh, tell all our audience, excisional surgery is the only treatment when it comes to
Exactly.
endometriosis.
Yes.
We are trying to help people give an alternative therapy because everyone does not have an access to an endometriosis excisional specialist. So for people who don't have a specialist consultation, or people who have time before they go through a surgery, or they have gone through a surgery and are recuperating, to prevent further recurrences, because as we all know, endometriosis is a recurrent disease. It is not something that once your surgery is done, it is over. So just to prevent all those things, these alternative therapies are something which might help you. Every body is different, so we would not say that you just go by what we are saying, but go by what your body is saying. Go give it a try and see if it's helping you. It's helped Arti. There's a possibility that it helps you also. So it's just that it's our way of promoting whatever is possible for you to get a relief from your symptoms. That's the only motive behind doing this session. That does not say that excisional surgery is not a treatment. Please, you have to go for an excisional surgery. You know? Uh, so uh, you also said, Arti, that diet has helped you. What exactly is the change that you made in your diet? How easy or difficult is it to make those changes in your diet?
Oh God, nothing comes easy with managing endometriosis
I
other than having the access to the golden treatment of excision. Even that's difficult to
Even
have
that's not
access
easy.
to.
Even that's not easy.
Yeah. So I basically, as I said, 7 years ago, I started writing the journal. I started watching, what's triggering me, what's not. Certain foods that I ate was triggering really bad flare ups because endometriosis is estrogen dependent and it is an inflammatory condition. I eliminated dairy from my system. I eliminated, I'm vegetarian now. I
Okay.
eliminated wheat, gluten, saturated fats, certain saturated sugars. So eliminated a lot, and which it made a huge difference because you remember. And this is what I keep saying: a holistic journey is not easy. It's a very difficult journey to go through, and it works step by step. So I started doing diet changes, and then I introduced yoga, I introduced meditation, I introduced all. Then came acupuncture, and now early last year, I did an allergy test, and I found out I'm allergic to a lot of foods.
Okay. All right.
So, like carrots, for example, I used to take a lot of because carrots reduce the excess estrogen in your body.
Correct.
Only
Correct.
to realize that I'm allergic to carrots.
Oh God. Oh,
Yes.
okay.
So now my diet is also more difficult to follow, but it's not impossible to do. And it's even more limited to what my endo diet was because of the food allergies. So it's so important to rule all these steps out and
Mhm.
then figure out what is actually triggering your body. And that is why it's so important for you to understand what works for you.
Correct. That's right. So one very important thing is what I realized is every body is different. What might suit you is not something which might not suit somebody else. What's
Exactly.
extremely important is to make an food diary and keep eliminating what is causing the flare-ups. And allergy, as you said, you can be allergic to certain things which you can't even think of. Something which is there in your diet every day, which you think is
Yeah.
absolutely harmless, like
Mm-hmm.
carrot for you, is something which might just create that allergy. And also, I think allergies keep changing over a period of time. As your body changes, as your chemicals in the body changes, your allergies also change. So it's something which you will have to keep monitoring and doing. So gluten, dairy, and I think red meat. Red meat again, I think is something which is like extremely problematic for people with endo. And soy is again something which is a
Oh, yeah.
very controversial kind of a health food. So people with endometriosis have to be really, really careful when they're having soy milk. There is so much of soy. If it is something which is, uh, you know, which is like absolutely organic, it is still all right. But something which is easily available in the market has a lot of estrogen, which is going to create a mess with your endometriosis.
Completely so. But even talking about the organic, I started to make my own soy milk. I said, let me try it. I
Okay.
reacted just from not even drinking it, but from
Oh
touching,
my. Yeah, because it
just
absorbs.
because, exactly,
Absorption. Yeah, correct.
exactly.
So, all in all, you have to be really careful about what you're eating, and your lifestyle has to change. It is not easy, and nothing comes easy. If you have to have a better lifestyle, I think you have to work hard towards getting it. And with endometriosis, it's more difficult because you yourself are fatigued so much that you really don't want to go exercise. You don't want to do anything. You don't want to get up from the bed. But I think you have to push yourself and take charge of your own life because that's when the change will start happening. So, Arti, how important is it to take care of your mental health when it comes to coping up with chronic diseases, especially diseases like endometriosis, which leaves you in pain and fatigued on most of the days, canceling plans at the last minute, you know, getting your special days ruined, so how is it?
Oh my God, like honestly, it is very, very important to take care of your mental health. It is just as you said, like, it's so unpredictable. Next, you'll be fine. Like, I'll be fine here. We'll be fine here 1 minute. Next minute we'll go and end a flare and we don't even know what's coming or going.
True,
you know
true.
but yeah, no, it's very, very important, in just not dealing with your illnesses or anything, just generally it is so important dealing with mental health, because like as I said, when initially back when we were diagnosed with endometriosis, if doctors said to us, you have to heal from within, or even now, a lot of philosophers, a lot of spiritual leaders, they always say what you seek externally is not there, it's what you have internally. So
Correct.
connecting internally and having that faith gives you so much strength to deal with what you can. And dealing with it doesn't mean that you're stronger than your pain. It's just that you're stronger to deal with it in a more manageable and a better way than to play victim to it.
Absolutely, absolutely.
So I just find that, and the one thing I need to really exaggerate on is chronic fatigue is not the same thing as being tired.
True, true.
You have someone say, oh, but I'm tired too. But no, I have chronic fatigue. It's not a competition and it's not a comparison, but no, it's not the same thing.
Absolutely, absolutely. Being tired
And
is
then,
very different. Being tired is very
yeah,
different.
exactly. And this comes with together with also pain. Chronic fatigue and pain together are just a
Deadly.
combination of its.
Deadly combination. True. That's right.
Yes,
That's
completely. And thirdly, like I was saying, my holistic journey, just hasn't been about the diet and the treatment options. It's been a constant battle, with your mental health being intact. Because, there are days that when you just feel, suddenly you start crying, suddenly you don't know what's going on, you don't have a reason why you're so sensitive, and people always label you as, oh, you're so sensitive. Yes, I am sensitive because I don't have control over my hormones. So I don't even know that, and then suddenly you realize, oh, hang on, it wasn't just your period. You had an ovulation day. So, your estrogen levels are sky high.
true. True.
And
That's
that's,
true.
and I just felt, and also like taking charge of your mental health is a journey on its own. Like I started doing yoga. As I said to you, I started doing meditation. I'm constantly listening to inspirational talks, spiritually inspirational and also life-changing inspirational, constantly making personal development or personal growth. You're constantly listening to mood enhancing music. You're just, it's just, you're doing aura cleansing, be it sage cleansing, rosemary cleansing, whatever you can to help your mental frame of mind. And this is the thing that I keep saying, you have to put in the work. If you
Correct.
don't, nobody's going to do it for you. So you
True.
either play victim to it, or you become a warrior and survive it the best way you can. And that is where your mental strength has to come into play.
True. Absolutely. Absolutely. What you said was like really amazing because playing a victim is the easiest thing to do. Taking charge of yourself and fighting against the situations that you're put into, you know, is all that makes the difference. You have to take charge of yourself mentally and physically and emotionally, because there are days when you really, best of your days can suddenly turn into a mess and you don't have control on it. But what you have to get control is how you deal with that situation that you've got into. So you
Completely.
So, Arti, you have been working extensively towards creating an, awareness about endometriosis in Kenya. So, what have you been doing about that?
So for the past 5 years, we've been filming a documentary about endometriosis, where I had interviewed researchers, scientists, interviewed certain doctors, interviewed women with endometriosis for their testimonies and everything. So, and in 2018, I released the trailer for it. But all this takes time.
Yes,
Also because of funds and the expenses of it, it always plays a huge
absolutely
role.
true.
So
That's right.
I still haven't released it, which is, and I always say there's a reason for something, because now we have so much more knowledge, and I can alter the documentary because we have more access to excision specialists now as well.
Correct.
And there's
Correct.
so much more research now that's being done. And
True.
so that's what I've been doing, and I'm still working at it. Once it's out, I will obviously share it with
Oh, we
everyone.
are looking forward to it. We're looking forward to it. I'm sure it's going to be like something which a lot of women like me having endometriosis, like us actually, with endometriosis would get help from.
Definitely. And also, I'm working on an art endometriosis piece. But what we have been doing to create awareness is I work with two groups. They're called, one is the endometriosis, the Endo Sisters East African Foundation, which
Okay.
is founded by Doris, a lady called Doris, and the Yellow Endo Flower, which is founded by a lady called S. And they're all warriors. So
Okay.
we work closely we have support groups, we have support sessions. I also work closely with a lady called Jambi Koikai, who has gone through another journey with endometriosis. I mean, I get goosebumps when I talk about her story, because she was actually listed as one of the worst cases in the world to have endometriosis. She had thoracic endometriosis and has had 21 surgeries.
Oh God. 21?
Until Yes, and until she had an excision done in America, the Center of Endo Care,
Okay.
and that changed her life completely. So we have been working cohesively, and we run support groups. We advocate in a way where we've been in this, I'm not going to say industry, but in this game for a very long time. So it's about, through our journey, it's about helping the newcomers. I say newcomers because they are new at coming into, they're now recently battling endometriosis. Some don't know how to go about it. Some don't know what to do. And I also, pre-COVID, I used to hold therapy sessions. So my last therapy session was creating, so we did a whole paint event where I had a few endo warriors around, and they expressed and released emotions caused by endometriosis through throwing paint and creating art pieces.
Wow. That's amazing. That's
Yeah, I
lovely.
prefer doing play therapy to just something that everyone else just does, which is I find it normal, but I just feel play therapy actually has a lot more value to it.
I'm sure. I'm sure. But then that's like so beautiful, actually. I mean, I'm sure you would have seen so many emotions coming up there, when you go through that, session. It must be
It
like
was
overwhelming.
It was actually overwhelming because none of us expected us to feel the way we did. And basically, what I did was we got eggshells and we had canvases printed. So it was a whole experience because, we had done food for endometriosis diets, smoothies, that boost and help with the endo symptoms. And eventually it was like every time you throw a color that's in your egg. So there colors that also represented purple for bruising, red for periods, orange just for what blending of um, bruising and period flow, and yellow for hope. And every color that you throw, each lady expressed an emotion. After that, I mean, we did cry,
I'm
because it
sure
was very emotional.
like extremely overwhelming, and they do make a lot of difference. Those pent up emotions which are there within you, which you really cannot express, just flows. And that is like beautiful. What you're doing, Arti, is commendable. And trust me, it is like so required to have more people like you doing the kind of work that you're doing for endometriosis.
Thank
I
you.
know
And
more people
like
join.
yourself.
Thank you so
And
much.
what you guys do is absolutely incredible. Like seriously, it's just amazing. And your sessions are just incredible because they're so informative. And it helps. This is
So
what
much.
helps. women. They say, or not only women, it helps everyone.
Exactly. So the main aim for us, like people like us, you or me, or Dr. Bimbi for that matter, is to spread awareness about the disease, not just for the women who are going through, but also for the family who is with them. It's just that what they need is support, and also the family needs to know what the person is going through. Because it's for the family also, it's equally difficult because they don't understand what the person is going through. They themselves are confused about what exactly is happening. you know so even they need to understand what that woman is going through, and that's the purpose of doing these sessions, so that there is an awareness overall, and it brings some change, at least somewhere, in some family, in some woman. One person at a time, fine, we're good with it. you know
Exactly.
that's how. And any parting words for our viewers?
I always part with these words, and every time I have an interview or anytime I just think it's so important. Know your body, understand your body, take charge of your body, because your body is, it's only you and your body who can manage it. You're the only one who knows what you're going through, and you're the only one. And you'll always have a lot of you'll always have people telling you, oh, it's on your head or it's this. But when you have control over it, you know how to make a difference, desensitize it all.
Absolutely.
Just take control. And I always say, and this has always been, do your own research, write your journals, and there are no quick fixes. Sorry to say, but there are no quick fixes, no matter what you do. And through all of this, Dr. Shilpa, my motto has always been turn pain into power and power into purpose.
Perfect. That's so beautiful. That is absolutely beautiful. There are a lot of comments on Facebook, which probably later you would have to see. There are a lot of appreciations coming up, and you have a lot of good things about you.
Oh, thank you.
So this was like an amazing session, Arti. Thank you so much for being on our show, and this was like beautiful. I don't have
No,
words.
thank you. Thank you, Dr. Shilpa, so much for even having me. I'm privileged and honored to be on your platform. I've got goosebumps.
Oh
When
God.
it's so nice to, it's just really nice to have somebody who understands your journey, because you've gone through it yourself, and exactly what you do is the purpose that we do it for has so much meaning behind it as well. It's so important to, and just so nice to meet like-minded people. So it was an honor being on your show. It was an honor meeting you, though, even if it's virtual.
Same
So
here. The
thank
pleasure is
you.
ours. The pleasure is ours. And I would like to thank all our audience who have been watching this program right now live on a Sunday evening, and to all the people who would view it afterwards as a recording. Thank you for being a part of our group, and looking forward to many more sessions, informative sessions ahead. Thank you so much, and have a lovely evening ahead. Bye bye.
Bye.